Okay, so we have here the two trophozoites related to your Toxoplasma Gondii. The first one, we have here the tachyzoid. So tachyzoid is just the actively growing, multiplying form. So this one would have crescentic in shape, crescent. Okay, and that one could be found here in the intestinal mucosa. This is an intracellular, could enter here your intestinal tissues, usually found here in acute infection. Another one, we have here the bradyzoids. So this trophozoite stage where they try to form here. Okay, so if this one is your trophozoites, okay, 100 of them, it try to form here as cysts. Okay, the entire cyst, okay, you call that one as your bradyzoids. Usually you could find this one in the muscles or could migrate to your brain. So this is actually the infective stage. Okay, for the life cycle, so if for example you try to ingest here your muscle containing that bradyzoids, or could also here by the ingestion of contaminated feces here coming that with the oocysts on that. Okay, the bradyzoids here contains the oocysts on each of that one. So try to ingest here, for example, try to ingest, for example, the muscle containing that bradyzoids. Once inside your body, could eventually try to release the sporozoids, which transform to become trophozoite again. The trophozoites, the first one, we have the tachyzoids. The tachyzoids here can be found in our intestinal mucosa, transforming here to become your bradyzoids. So, magpo-form ulit sila mag-group ulit sila, they form a cyst in the form of your bradyzoids, and that try to lodge here in your muscles or even in the brain, and could eventually infect again here another cycle if you try to eat or ingest here containing that cyst containing here your or the bradyzoids, the cyst containing the bradyzoids. Okay, we have here the laboratory test to diagnose the presence of your Toxoplasma Gondii infection. So the best, although you could perform here the DFS for identification of your oocysts, but then again, the best to recover here or diagnose patient having this infection would be serological testing for identification of your IgM and your IgG antibodies. So you could have your antibody detection, could just have here your ELISA, could also have the sandwich method for that. And then we have also here the Sabin-Feldman dye inhibition test. Okay, so you are using here methylene blue as your indicator. So pag may color, so that will be considered to be negative. In the present absence of the blue color here, then we consider it as positive because again, that one is inhibition test. Okay, the last one we have here, the Pneumocystis Gerovesi. The other name for that, or the former name, we have the Pneumocystis Carini I. Okay, so this one belongs to your Ascomyces fungi. So I try to cause here your artificial or atypical interstitial plasma cell pneumonia. So it's a pneumonia manifestation. So regarded here as the leading cause of the death among HIV patients. Okay, this one is associated also here with the Kaposi sarcoma. Most likely, the patients with the AIDS would have this infection along with the Kaposi sarcoma, which is your skin manifestation with the HIV. Okay, then you get infected here by your Pneumocystis carinii, primarily by respiratory droplets by person-to-person contact. Okay, for the morphology, so this, although it's a fungi-like organism here, but the morphology or the stages also made up of the trophozoite, we have also the C stage. So that's why we are discussing here in this topic. Okay, the trophozoite would have here round amoeboid morphology that would have here one nucleus. And for the cysts, would have here 4 to 8 nuclei that may arrange, organize to form here the rosette formation or rose-like arrangement. But if that one is disorganized, it would have your scattered arrangement. So identification of this one, you could have your identify here this organism here by your stain. So you could have here your GEMSA, hematoxylin iron, hematoxylin, orgomorphs, methylamine, silver stain. Another correction lang sa Blastocysts hominis, the nuclei of that is only 2 to 4. Okay? And finally, as a summary, so out of this one, we have here the different species here which try to cause or associated with the AIDS infection. So This includes your Toxoplasma Gondii, Isospora belli, and we have also your Cryptosporidium parvum, plus this Pneumocystis carinii. And your species related to your Mycospora, also trichosteria, associated with your AIDS infection. Okay, so thank you for that.